I'm Lonnie Parsons, Physician Assistant and Clinical Director at St. Rose Integrative Medical Center, where we offer the revolutionary non-surgical spinal decompression procedure that has been proven effective in relieving lower back pain and sciatic nerve pain. The DRX 9000 is a machine developed to treat disc herniation, degenerative disc disease, facet syndrome, sciatic nerve pain, and spinal stenosis. It utilizes high-speed computers to calculate a logarithmic spinal decompression treatment curve for each patient. The DRX 9000 is designed to provide pain relief for compressive and degenerative injuries of the spine. With measurement devices inside the DRX 9000, changes in decompression forces experienced by each patient are monitored. All of this data is constantly fed back into the computers. The computers continually calculate corrections and ensure the patient's therapy is true to each patient's logarithmic curve. The DRX 9000 has given patients relief from chronic back and neck pain and has allowed them to resume the activities they love. It provides relief of pain and symptoms associated with herniated discs, bulging or protruding intervertebral discs, degenerative disc disease, posterior facet syndrome, scoliosis, and sciatica. The therapy is non-invasive and non-surgical. The theory behind spinal decompression is a process whereby forces are applied to the spine in a manner that maximizes spinal elongation. Spinal elongation is maximized when paraspinal muscles, the muscles that guard the spine from injury, are relaxed. When paraspinal muscles relax, applied spinal decompressive forces spread apart the bony vertebrae of the spine. This relieves pressure on the nerves and intervertebral discs. Where the spinal elongation occurs, pressure drops within the disc, which facilitates movement of the fluid, carrying nutrients and oxygen inside the disc. Additionally, the reduction in pressure can help draw in herniated disc fluids, reducing the size of the herniation. Over time, the muscles and ligaments surrounding the disc can actually be retrained to help keep that disc space open. During each 30-minute treatment session, the patient relaxes comfortably on a heavily padded bed after being secured into position by an upper and lower body harness. The patient can completely relax by watching a DVD, listening to music, or simply taking a nap. Typically, each 30-minute session is divided into 18 phases, where spinal decompressive forces alternate between a maximum and minimum therapeutic level. The cycling of forces in this manner appears to create a pumping action that simulates the natural processes responsible for nourishing the intervertebral disc. Patients that will benefit most from the DRX may be those who are diagnosed with herniated discs, bulging discs, sciatica, degenerative disc disease, or facet syndrome. Spinal decompression therapy can also provide relief in patients suffering from advanced scoliosis. Some patients may experience light side effects with this type of therapy. Mild muscular soreness during treatment may occur. The sensation would be similar to what a person might experience at the onset of a new exercise regime. Most patients find this therapy quite comfortable and relaxing. During an average 30-minute session, most patients experience a gentle stretch in the lumbar spine and tend to fall asleep. Adjunctive therapies to spinal decompression typically include electrical stimulation and cold therapy. During spinal decompression therapy for the low back or the lumbar spine, patients remain clothed and lie on a motorized table, the lower half of which can move. A harness is placed around the hips and is attached to the lower table near the feet. The upper part of the table remains in a fixed position, while the lower part to which the patient is harnessed slides back and forth to provide the traction and relaxation. The patient should not feel pain during or after the decompression therapy, although they should feel stretch in the spine. Decompression therapy typically consists of a series of 15 to 30 treatments, lasting 30 to 45 minutes each, over a 4 to 6 week period. Sessions are conducted in our clinic. If you suffer from low back or neck pain or have symptoms of neuropathy in the upper or lower extremities and think this might be a therapy that could benefit you, please schedule an evaluation today. Because at St. Rose, we want to help you return to the life you love.